A lot of people like myself, they start a dialogue on the topic of fertility with their OBGYN or their primary care doctor. And those visits are very short. And they're sometimes, 5, 10, 15 minutes. And they happen periodically. And they don't tend to go into a lot of depth on fertility. And frankly, none of us are educated about fertility early. If anything, it's all about like how to not get pregnant, right? And so I think what I discovered was that conversation about fertility early on in a proactive manner just wasn't happening. And a lot of it was the burden that we're putting on our healthcare providers overall, but also, primary care doctors, as an example, are not trained in this topic. And we have this kind of group of providers called fertility specialists, and they're really the experts, but they're also focused on the diagnosis of infertility and the treatment of infertility. So this preventative, proactive part of the equation was just fundamentally missing from our healthcare ecosystem.
Welcome to Reclaim, a podcast powered by Future Digital. I'm Destinee Berman, founder and CEO of Future Digital, where we partner with venture-backed health, wellness, and family brands to scale with trust. Each episode, I sit down with founders and growth leaders to uncover two things: the story behind the brand and the decisions behind the growth. Let's get into it. Jessica, welcome. I'm so excited to be having this conversation with you for a couple of reasons. Fertility is a personal journey of mine. We got to meet briefly in person at JP Morgan, and it's always, or at JPM, and it's always helpful to just have had that in-person contact as well.
Totally. Well, I'm sorry you went through it yourself, but it's one of those clubs where, you don't love being in it, but once you have been in it, you really understand it deeply. And I think there's a bond amidst people that have gone through it. So I was thrilled to have met you too and excited about today.
Why don't we start with your personal journey? Because we were also just saying so many of the health origins start with lived experience. So I think it'll be valuable for the listener to hear your journey and then how that led to the birthing and origin of Frame Fertility.
Yeah, of course. Yeah, I mean, there's an interesting intersection for me on this journey of, I'd say, personal and professional. So, professionally, just to give folks a sense, I mean, I've worked in healthcare my entire career. I've worked at big companies. I've worked at small companies. I also, for better or worse, deeply understand healthcare insurance and employer insurance and kind of the economics of that business. So I understood the field of healthcare. And frankly, I was also one of those people that tried to be on my preventative care visits, my regular pap smears, all those things. I feel like I was trying to do everything right from a kind of professional and even a personal sense. And I think that's why this was such a shocking experience for me, because I didn't expect that my fertility journey was going to be this challenging. And I was consistently told, I'm a healthy person, everything should be kind of quote unquote fine, just come back when you're ready, those types of messages. And I was just really stunned with how overwhelming the journey was, how fragmented it was, how reactive it was. And, again, for someone like me that in many ways had all the advantages, I really struggled, as did my partner. And after 3 years of struggling, trying, paying, tens of thousands of dollars out of pocket, going through fertility treatments, yes, we're one of the lucky ones that has a baby, but it was not without a lot of different challenges, I'd say financially, emotionally, logistically. And so I think I was really compelled to want to explore the space better. Why is it like this? And I think more importantly, I ended up with a baby on the other side of this at the height of the pandemic. And I think, let's be honest, it's not like building during the pandemic was easy, but I think for many of us during that time, we had this desire to do something meaningful now that we were kind of quote unquote trapped indoors and for us with a newborn. And so I couldn't get out of my head what we had just gone through. And again, I had my partner right there next to me. And so I built Frame, not because it was convenient, but because timing really revealed urgency for me to want to solve this for other patients as well too.
What did you find in going through this process for yourself? And then as you were evaluating this from I want to solve this founder's conviction lens, that's, in the process and the timing, offering fertility coaching, I'm Curious to kind of unpack that with you. Like, what did you find, and then what did you aim to solve in this journey?
Yeah, I mean, I think first and foremost, I didn't go into this with like a solution in mind, or even that I was the one to solve it. I just went in very frustrated by the problem. And I think that that is at its core what founders tend to be obsessed with, is obsessing the problem. And that's kind of constantly what I'm thinking about, is how can we solve this problem or this problem, et cetera. And so I think what I really wanted to do was figure out why this was so hard. And I think what I learned through that experience is there's a variety of different reasons, but one of the biggest root causes is, a lot of people like myself, they start a dialogue on the topic of fertility with their OBGYN or their primary care doctor. And those visits are very short. And they're sometimes, 5, 10, 15 minutes. And they happen periodically. And they don't tend to go into a lot of depth on fertility. And frankly, none of us are educated about fertility early. If anything, it's all about like how to not get pregnant, right? And so I think what I discovered was that conversation about fertility early on in a proactive manner just wasn't happening. And a lot of it was the burden that we're putting on our healthcare providers overall, but also, primary care doctors, as an example, are not trained in this topic. And we have this kind of group of providers called fertility specialists, and they're really the experts, but they're also focused on the diagnosis of infertility and the treatment of infertility. So this like preventative, proactive part of the equation was just fundamentally missing from our healthcare ecosystem. And I think, frankly, I think we're all feeling this right now, that everything in healthcare has been reactive and not proactive. And I think this was so emblematic of that gap. And I think the other big thing, though, is the emotional, the mental side of this journey is completely overwhelming. I mean, the studies show that basically getting a diagnosis of infertility is comparable from a mental health perspective to getting a diagnosis of cancer. It makes you feel completely terrible in a really strange way. You feel like something you did was incorrect or wrong. You missed something. It was your fault. And I felt this a lot. I carried a lot of shame and a lot of stigma, but you have no control. There's not a lot of good answers. This diagnosis of unexplained infertility, I think, drives everyone bananas. And it definitely played a role in my dynamic too. And so I think that side of the equation also just was not being addressed. We were only kind of treating the medical side once someone was in a crisis, but we weren't talking about how this just completely disrupts your entire life beyond that. And I think that was the other big thing. And so to your comment, that's why this concept of fertility coaching comes up, because this journey, yes, it has a medical element, but there are so many non-medical elements that are completely disrupted by your infertility journey. And that's what we really wanted to solve for, in addition to ensuring that this dialogue happens earlier. So those were the kind of the two intersection points that we really noticed the problem and wanted to dig in and figure out, what does a solution look like?
It's interesting because with such a natural, organic process, it's so easy for it to bring up our own inadequacy. Like even without realizing it, just subconsciously, it just hits that mode like right away. And so we think there's something wrong with us, or maybe there's something wrong with our partner. And like, why? Because it's supposed to be so natural, right?
Yeah, absolutely. Yeah.
How are you thinking about, so you've partnered with over 5,000 providers at this point, and I definitely want to go into the earlier journey as well. So you partner with 5,000 providers, and then with 1,200 trained reproductive specialists in the whole country.
Exactly.
How is Frame thinking about the training and the care, and then offering that care earlier on in the process?
Yeah, I mean, you brought up a couple of really great points, one of which I still can't get over, that there's only 1,200 trained specialists in this field, and 8% of counties actually hold them. So not only are there few, but they're in very small pockets of the U.S. You can probably guess where, in some of the bigger cities on the coast, right? So we have a huge access problem. And I think, unfortunately, that really puts a lot of strain on the system alone. But frankly, let's be honest, we're also seeing a big gap as it relates to OBGYNs and PCPs because of burnout and so much we put on them too. So again, there's a provider shortage generally. But all that said, I think what we really wanted to try to solve for is this kind of concept of how do we intersect the patient earlier. We didn't try to convince patients to think about fertility earlier, although frankly, like generation to generation, we're seeing that happen naturally, which is fascinating. Like millennials are different than Gen Z, et cetera. And we're seeing that conversation start earlier for sure. But regardless, what we decided to do was we wanted to partner with the entities that already had trust and already were touching the patients earlier in the journey. So to your comment, PCPs and OBGYNs, and 83% of conversations about fertility still start with that type of provider. But again, they just don't have the space, the time, and sometimes the education to go into it. So that's where we decided to start our focus. And so the good news is both myself and my co-founder, we've been working with doctors for almost our entire career. And we knew that we needed to figure out ways to build trust with them so that they would actually surface what we were doing to their patients. But we also had to make it super easy. We knew we didn't want to make like a separate portal, a separate login, do something separate that complicated the journey. We wanted to weave it in. And that is frankly like our expertise. My co-founder built EMRs for a living that doctors use, and actually the one that most OBGYNs use. And so basically what we decided to do was we really wanted to build trust not only with the providers, but as a result, their patients. And that was kind of our intersection point with, I know we were talking earlier, the provider, but also the patient directly. So we care for their patients under their kind of quote unquote roof.
I see. And then are you inserting your trained fertility specialists in there?
Yeah, that is totally right. So we do the early screening, we do early clinical visits. We also do some of the non-clinical things that I was mentioning earlier, but we're basically creating a space for any type of fertility conversation to happen, whether you are just curious, starting to plan, actively trying, or even contemplating in treatment. And we can facilitate that dialogue, make sure you have space for it, facilitate testing for you and your partner, all upstreams. And then if you need to get to a fertility specialist, we will absolutely help you navigate that journey, understand the building blocks, prepare you for it, what you're going to encounter. It's a whole different vocabulary I learned too, like all these terms, so many acronyms, like we're going to make sure to set you up for success if you need to get there. So starting earlier, navigating down.
And so how are you training the fertility specialists in your network, just given the funnel of education right now?
Yeah, I think, interestingly enough, one of the ways that we've done this is we've utilized what are called APPs, advanced practice providers. So think nurse practitioners as an example. So we've really leveraged that type of clinical population with the training that comes from ASRM and the fertility universe to basically insert that type of care and expertise earlier. And this is something that I think a lot of specialties are starting to do now, this kind of balance of generalist specialists. How do we do this better? We're starting to use different types of providers to deliver that sort of care under the supervision, of course, of a physician, which we have a medical director. And then again, we're also addressing the other non-clinical factors that frankly play into this. I mean, so often patients don't know that certain lifestyle decisions they're making significantly impact their fertility too. They're not medical in nature, right? But we're helping bring awareness to that. And also just the conversation of age. Like it's wild to me that, when we started trying to conceive and I was in my late 30s, I didn't know that would be hard. So again, sometimes it's not even a medical conversation. It's just a conversation about fertility readiness, what it means, how to understand your ovulation and menstruation cycles. We don't do a good job of that either.
Right.
So again, you can deliver a lot of this care and support in different ways with different types of providers that don't need to be the reproductive endocrinologists and infertility specialists that are very well trained for IVF and these complex procedures. Like we can use different types and we should, given the shortage.
Got it. That makes total sense. I mean, I admit to being in that group. I did not even think about age, freezing my
Oh my gosh,
eggs.
right?
I feel like I'm reasonably informed and I lived in, on the coast and I just am shocked actually looking back at how uninformed and how uneducated I was.
Yeah. And again, I think we carry that as something we did wrong when fundamentally it's a systemic thing. And to your comment, now that I reflect back, I'm like, if I didn't know, I don't understand how anybody is going to get through this. Like we are definitely not doing a good job educating people here. So yeah, it felt like such an obvious gap.
And how did you decide on insurance models, cash pay models? Like, how did you unpack that?
Yeah, and it's an evolving conversation. I mean, you can even see now in the news, right? We're starting to see this resurgence of cash pay models in a totally different way that, we've tried in the past and didn't work, but I think for a whole host of reasons are starting to stick. So technically we have both. We have a model where it's all billed under your insurance, under the kind of framework of the provider that brought you to us, so your OBGYN or PCP or even your specialist. And then we do have a cash pay model for, frankly, the services that are not covered if needed, and or if you want to go all cash pay. So we do have both. And that has kind of been, I'd say, a philosophy from the very beginning. We just wanted to make this process easier to access and use existing frameworks, but also give people choice. And because these days, sometimes cash pay is preferred, and especially for things that are unfortunately not covered, we have to still have them that way, which is unfortunate. But
What's the breakdown between the two with your current patient base? I'm wondering.
yeah, it's very distributed as it relates to the clinical care that we deliver. The vast majority of that is run through insurance. It's the more non-clinical components that are not. But I will say, the other success we've had, which is awesome, is in partnership with some of these large groups, we have actually gotten them to bundle those non-clinical services into what they provide, just under their roof generally. And in particular, in partnership with fertility clinics, because I think what fertility clinics had been learning is that they see that emotional burden up close every day. And when you look at the data, a lot of patients, no matter the coverage they have, are still dropping out of care. So they were seeing this challenge. And so we've gotten them to bundle this into their care at no cost for the patient. So I'm always looking for ways to get this as part of the system. And so we've figured out ways to do it clinically and non-clinically in a lot of settings already, which is exciting.
I was curious about that as well. Like, what's a breakdown between the utilization of service type, right? More of the emotional early education versus more fertility and IVF needs.
Yeah, totally. And we've also had some great success working with other partners that see this need very clearly too. We're now working with one of the largest pharmaceutical partners in the industry, and they're delivering this kind of fertility coaching service, and we're doing that with them. And they provide that entirely for free because they know that this really matters. And I think this concept of fertility readiness and education and coaching is starting to become more commonplace. I still think the word coaching we've got to get it into the ecosystem in a positive way. It's definitely had its, full set of ups and downs because unfortunately there's a lot of fertility coaching that you find online that isn't great. But I think it conceptually really works. And when done well and with these established partners, we've seen remarkable results.
What are the current results and winning outcomes that you can share, at this time?
Yeah, I think there's a couple different things that we think about here. One is patient experience, obviously, and patient satisfaction. And I will tell you, in the entire time I've been running Frame, we have never had a patient SAT score below 95. So we have always been in the high 90s. And I read every single one of these surveys at the end of the week. It's actually my favorite thing to do. And I really enjoy actually seeing the commentary, the good, bad, and the ugly. But we get a lot of really great comments that frankly bring tears to my eyes almost on a regular basis. So that's going to be one big thing is patient experience, patient satisfaction. A lot of people have not felt heard or supported, and that's something we really care about. The other big thing is patient retention. So a lot of patients at some point drop out of this journey because they're overwhelmed, they're stressed, they're confused. Just like I mentioned, the emotional, the mental burden of this is incredible. And so we look at patient retention, especially once within a provider group, either OBGYN or fertility clinics, and we've seen incredible results there. And that's been phenomenal to see. And then the other thing that we look at is how much is this lightening the load on the current clinical staff that was absorbing a lot of this, sometimes well, sometimes not well, but in general, how has it reduced their workload? Because I think we're in this together. We very much believe that Frame plus brick and mortar care providers has to be the solution because we're not going to deliver your baby. We're not going to deliver your IVF. But this type of tech-enabled solution works really well paired with brick and mortar. And so we look at how much time we are saving nurses, doctors, staff, and we have done a few time-based studies that reveal that about 50 minutes per patient per week has been unloaded from those staff as a result of us weaving into the journey, which is phenomenal, obviously, too.
Wow, that's fantastic. My goodness. Is there data that correlates to the patient retention and a larger percentage or a larger group getting to their achieved outcomes?
Yeah, absolutely. Yeah, we break down patient retention in a few different ways. We look at it as it relates to patients showing up for their in-person visits. We look at whether they started care and stopped it at any point in the journey. We also look at it within the OBGYN environment. Are they continuing care from a preventative perspective as a result of what we do? Because a lot of times we're surfacing, yes, things related to fertility, but also things that relate to their overall health. So it varies a little bit, kind of provider type to provider type. But I'll say that when we looked at some of our results last year, we basically saw around a 72% improvement in patient retention once patients had started some form of treatment in the journey. So we've seen pretty remarkable results. And I'm super excited because we're actually going to be doing a randomized control trial. It's actually happening right now with a woman named Ali Domar, where we're actually going to study this and where patients are randomized to frame and obviously randomized to not having frame. And what does that do to their patient experience? And retention is one of those elements. So soon we will have published results because I care a lot about that, outside of just our kind of real world observations too.
Wow. I'm looking forward to those results.
Yes, Allie's like a mentor to me. I come from public health, so like I love research, I love data, and so again, we've been wanting to do this for a while. It takes some time. This will be our third published study. We have two others, and I'm super excited about it. It's going to be really meaningful for a whole host of reasons. So.
In terms of, so you're primarily B2B to C.
Yes, that is correct.
And the trust is primarily enabled through, to your point, already existing infrastructure, physicians, OBs. So I'm curious if you've had to do, I guess, really kind of going into the growth conversation, like what friction in terms of connecting with a patient or not, and kind of moving them through the trust category and really trusting this process and trusting this solution as part of their care.
I mean, I think that's one of the reasons why we felt like we saw results so early is again, and we knew that patients were already seeking care from this type of provider already. And so we were folded in and recommended by their doctor. And I think that's why it became sticky early on. And then obviously we had to prove it to them. And I think, one of the things that we pride ourselves on is that we are a concierge-like experience. And so in some ways, right, your doctor referred you, but what we do is a little different than what they do. And I think it's been great to see that, patients are super jazzed that they not only have what we do, but they have what we do at 9 p.m. at night on a Thursday or Saturday afternoon at 1 p.m., right? So they're getting this kind of handheld experience in a way that their doctor wasn't offering. So it also just feels more curated to them, more on their timeline. And so we do things a little differently. And I think that has been remarkable to see the feedback from patients, that it feels personalized, it feels easy, it feels accessible. And so again, I think that's why we continue to see great results. Yes, we got the patient from their doctor, but we have to prove to them that we're adding value. And that has been a remarkable thing to see.
And so initially, how many providers did you partner with in that first phase, then had to prove the value? And then I'm curious about like the growth trajectory from there.
I mean, the founder journey is nothing if it's not incredible how you see how people you meet in different walks of life blossom in ways that you never expected. So to give you a very clear example, again, when we first built Frame, we actually delivered it direct to consumer. We wanted to prove it with patients first. It was very obvious from day one. I mean, we had paying customers in the first month, which was phenomenal, right? But again, I think we still knew that the root cause still needed to intersect the provider journey. And the long story short is I just spent a lot of time in the first few months talking to every OBGYN and reproductive endocrinologist that would ever talk to me. And one of them said, well, let's try it. Let's try it in my practice. And so we supported her practice for a few months. And the results, again, were phenomenal. And patients were, telling her how much they loved the service. Again, it was taking a lot off her plate. And what I didn't know is that she happened to be on the clinical advisory board for one of the largest OBGYN networks in the entire country, right? And so these are the serendipitous things that happen. And so a lot of these early relationships and early proof points just blossomed in ways that I never expected. And it kind of brought us to the top tier of these provider groups. I won't say super quickly because everything in founder world moves slower than you ever want. But like in the grand scheme of things, we're a few years into this and we're basically working with the number 1 and 2 largest groups on every spectrum of the journey, right? So I think that's what's phenomenal is it has the ability to grow. If you can be accountable and deliver what you say, I mean, it's kind of incredible how some of these things can ladder up faster than you ever expect.
So then I guess on that note, like what's next? I read about a LabCorp partnership. So I'm very curious around what's next. And then I kind of want to take this more into your personal journey route. And, you're working with your partner, working with your husband. I think there's some things that we can touch on there.
Yeah, these are minor things, right? No big deal. I think LabCorp's been such a phenomenal partner. I was actually on the phone with them this morning. I think what's been, again, incredible about this is we recognize the B2B2C intersection point within the provider community was kind of the inflection point for our growth. And that was really helping to bring us to more patients very quickly. And I still believe that that is one of the anchoring pieces of what we deliver and what we do at Frame. And what also ended up happening is, we ended up getting introduced to some of the kind of, I'll call them ancillary partners in the arena. So I mentioned pharma, LabCorp is another one, where we then were starting to evolve the offering, even just slightly, to partner with them that then fed the core business. So with LabCorp, as an example, right, we basically built a curated fertility bundle that is labs by LabCorp, and bolted onto it is a virtual visit with Frame and care navigation. So that means that anyone can get this fertility bundle of testing, but not just get the results in their inbox, because I think I did all these tests and you get the red, yellow, green, but you're like, what the heck do I do now? And sometimes you walk into your doctor and they're like, oh, we got to repeat these. I don't know what this is, right? But again, we wanted to do that set of testing, but we wanted to give you direction after. We wanted to give you the ability to talk to a medical provider and be able to take next steps. And so we built that bundle together. And that bundle, again, may lead you to more care with us, more support with us, but it also might lead you to getting set up with an OBGYN to treat your endometriosis that we found. Or it may end up leading to you actually do need to get into fertility treatment, and here's a fertility clinic that is going to be a great fit for you, right? And so it feeds our core business, but broadens access. And I think if there's one thing I'll leave you with is I always want to think about the access problem as our first problem to solve. And so I think LabCorp helps to open up a different segment of the population that may not be in their doctor's office, but really wants to get fertility testing. And I want them to get the best fertility testing out there, but in a way that they don't have to repeat it later and with better direction and support. And so that's what we built with LabCorp, which has been so fun.
And is that launched and live or?
Yes, it launched last year in May. We put out a press release. It's kind of rolling out in a few different avenues. I'd say more in a pilot-like format before we kind of roll it out across the board. But we're doing it both on the B2B side and on the direct-to-consumer side. So there's going to be 2 different segment angles here too.
Oh, very interesting. So you use D2C to get the data, to prove the model. It's quick and that's expensive. And then at which point did you decide that you are going to pause D2C acquisition efforts, or is that still in the mix?
It's interesting because when we first did direct to consumer, I mean, I have to be honest with you, we didn't even run Google or Facebook ads. It was word of mouth. And so I didn't really put much effort into direct to consumer. It kind of happened rather organically. And it happened under the kind of framework of learning. We just wanted to learn what other patients thought. Was it just us? Is what we struggled with what other patients struggled with? And I think the universal answer was yes. And it was so incredible to watch, almost like fire. Everybody I'd talked to would say, well, I have other friends that have also gone through this. Let me just connect you to them, right? So we didn't technically try to market this direct to consumer, to be clear. As we were having those patient discovery conversations, we were also having the provider discovery conversations. And that's when we realized the intersection was the business model. But to your comment, I do think there are broader direct to consumer angles here. And obviously, like the LabCorp partnership is one of those. And there may be a larger play later. It's, as you can appreciate, we need to stay focused and not try to overextend ourselves as well, too. So.
Well, that actually is a very natural transition to your founder journey. Was there moments where you said, okay, I'm going to have the conviction to turn this into a business, right? Because it started so personal. You did research, you've been in healthcare, first time founder. Yes,
that is correct.
Yes.
That is correct.
So in that transition of that identity, I'm wondering about those moments.
Oh my gosh. There's so many days too that I'm like, how did we get it? Like, how did this happen? How did we get here? And it's all incredible to reflect back on like the little things that happened that got us here. Because again, we didn't set out wanting to build a company, my partner and I. We just set out kind of frustrated and wanting to figure something out. And we also looked at other companies and thought about joining them too, to be very frank. But I think what ended up happening is, we have the good fortune of having worked with some really fantastic entrepreneurs over time. And, we both worked at early stage companies. And I say that because like, until you've been number one, it's still not that early. I think we thought if we had been early, but again, totally different. And, as we started to have those conversations with people about this problem, about what we were seeing, what we heard back was, you all should do this. Like, we believe in you. And both Corey, my husband's name, both Corey and I's prior bosses and CEOs both invested in our company. And, I think it was their pushing us and their encouragement that we could do this and that this is a big problem that really helped us feel confident in trying. And, again, it's a trying journey every day of the week. But I also feel like there's nothing more important that I could do with my time. And, every day that we look at our daughter and we think about how this almost didn't happen, we feel really proud that we found a problem and we're solving it for other people. And it is so hard, but every day of the week I get to read these stories. And again, I can't imagine anything more important I could be doing with my time.
What about the bold decision, in my opinion, to be working with Corey and to be working with your partner? Because I can see so many different sides of that. And I'm just wondering what the exploration was, or was it just a gut instinct?
Yeah, I mean, it's totally insane to your comment. I guess the thing I'll say about Corey and I is we have dabbled a little bit together in the past. We had done some consulting work together. We're kind of two sides of one coin. People that know us really well will actually remark to us that, if we weren't married, we'd be great business partners. And ironically, now we're both. But like, we are kind of two sides of one coin. And so we very much complement each other. And I think, frankly, in this journey, the fertility journey where we both experienced, female and male infertility, like this type of partnership probably makes the most sense. But there's more of us out there than you think. And I think when I talk to people that have done this with their spouse or maybe, their sister as an example, what I hear back is what we really feel, which is it makes you have to ruthlessly prioritize because everything happens under one roof, right? So we can't afford to do things together that are going to sacrifice our personal life and also our professional life together. Because again, we're all in. If anything, I think investors should feel really excited about that. Like literally, we are all in. But again, it makes us have to really prioritize in a way that I think is very healthy as a founder, because you can get very distracted. But we have to ruthlessly prioritize. I think parenting actually does that too. And then the other thing is like, we know each other so well. And I fundamentally believe, people can disagree with me, every co-founder relationship is a marriage, just a different form of marriage. And we have known each other for 15 years. I know when I see even a certain look on his face, I know exactly what he's thinking, right? And I know his strengths, I know his development areas. And frankly, it's really fun to see him in a professional setting. But again, we know each other, and the trust there is, I mean, it's incredible, right? I don't think that any other co-founder relationship has that level of trust. And again, it is a pretty significant bond. And it's amazing to be on this journey with him.
I can see that. Speaking of investors, if you want to go into this, any fundraising goals or plans in the near future?
Yeah, it's a fun point in the journey to be at where, you have options and decisions on that journey that we're contemplating that we definitely weren't contemplating, even a year ago. So I think we're in a really nice place of stability. And again, as a result, we can make different decisions than we could have in the past. So I'll leave it at that. I don't know what the future holds from that perspective. And it's, for once, it's not like at the forefront of my mind. What's at the forefront of my mind is delivery and scaling, because the business is here. Now it's leaning into it. And that's the fun part.
Okay, so I guess just a couple more questions before we wrap up. Speaking of scale, what would you say, and then also through the lens of focus, what are the growth and scale bottlenecks in front of you right now that you do want and need to focus on, because you can't do everything?
I mean, I think what's fun in the era of AI, right, is what's breaking is not the tech. If anything, the tech is wild and crazy and fun and very different than it used to be. I think what I think about a lot in this scaling phase is consistency of experience. How do we make sure that we are maintaining the human touch that our product brings? We are not an AI chatbot. There may be elements of our product that we fully power with AI over time, but the human experience and the human connection will always be part of what we do. In fact, if anything, I believe AI just makes it possible to not have to choose between humans and efficiency as we used to have to. But I also want to make sure we have sound clinical protocols. And as a result of our clinical advisory board and our medical director, we definitely do. But we have to continue to hold that standard as we expand clinical areas. And just maintaining quality in larger numbers, larger team member. Like everything just gets pressured in the scaling phase. And so things that used to work don't anymore, and they break more frequently. And so it's thinking about that next level of people and hires that are going to be best in the scaling phase. And those are different types of people that are in the earlier phases.
Okay, two things. You shared quite a bit of learnings and insights today. So if you had to summarize a key learning on your path as a founder and what you built in fertility, you could say that's a crowded category, even if you are entering much earlier on in the process. So what's a key learning you would share? And then given, as this podcast is called Reclaim, what is Frame reclaiming for its patients, or what you're reclaiming for yourself?
All right, I'll start with the learning. I thought about this a lot because I saw this in one of the questions. I had to learn that intensity and sustainability are different things. People that knew me pre-Frame knew me as a person that was in box zero. I was on top of everything, and I felt very compelled to deliver, probably in a very perfect way, everything that I did. And don't get me wrong, it's definitely led me down the path of burnout a few times, but I was just one of those people that wouldn't leave the office until everything was tidy. And so that was what I was before. And I think that level of intensity, don't get me wrong, you have to be very intense in this journey, but you also are running a very, very, very long marathon. And so you have to do things that are sustainable. And I think that has been my biggest learning on this journey. And frankly, this journey very directly overlaps with becoming a parent, and the same rules apply. It's I had to let go of perfection in parenting and in leadership. So that has been such an eye-opening experience, and I struggle with it still every day. Like I look at my inbox sometimes and I'm like, I can't do it. But I just have to be okay with saying no, and I have to be okay with letting stuff sit. But I will say, like, one thing that I believe very firmly in is I want to be known as an accountable person. I believe that that is a defining characteristic that is very important to me. So that will never go away, but it just has to be okay to say, I won't do that right now, or I'm not going to do that. And I think that's been one of my biggest learnings.
I love that. And I can certainly relate to that. There are certain days my toddler does not get a bath.
Right? Exactly. Oh my gosh.
What it is.
Days, I feel like we've gone close to a week.
Okay.
Like I'm just like, oh, you smell that, like it's okay. So
My husband's on a work trip. He doesn't get a bath.
Yep. Nobody knows. No, yeah, exactly. So just letting go a little bit.
Yeah.
So, and again, standard day battle. Reclaiming. I obviously love the name of your podcast. That's why the core business name of Frame is actually not Frame, it's Reframe. So like I think about this concept of reframing, reclaiming a lot. And I think the things that bubbled up for me on that topic are reclaiming agency. Because I think, again, this whole journey feels like a crisis that you can't control. And you feel like you got to the starting line of fertility, and frankly, it's infertility, and you have no clarity, no support, no roadmap. And so I want to help people reclaim agency. And also with that, reclaim time, because it can completely drain your life. And so I want to give people more control and agency to make the decisions that are right for them. So that's what I thought about.
I love that. Well, thank you. Thank you so much for this conversation. I really enjoyed it, and I appreciated the range of topics and the depth as well.
Yeah, no, likewise. Really enjoyed it too. Thank you so much for including me.
Thanks for listening to Reclaim. If you're building women's health, consumer wellness, or family brand, and you want a growth partner who understands trust-based categories, visit scalewithfuture.com. And if this conversation resonated, follow the show so you don't miss what's next. I'm Destinee Berman. See you next time.